Isn't this fun? Navigating healthcare is fun.
This is just...
See how it says hospital fees?
Holy mother of God.
That's what I'm saying. So we're about to get to the tea. All right. So I thought it would be fun to break down how much I've spent so far in medical costs for my knee. Hey, everyone. I'm Hallease, and I'm a filmmaker and storyteller.
And I'm Mr. Hallease. And when I feel the cold touch of winter's breath upon my own bronchus, I cough uncontrollably because of asthma.
And this is a Stumblewell podcast, a couple that you know, talking about marriage, relationships, other such things, anything reviving, really.
Roll the music. I sure would love some good comments right now to sustain me in these cold times. Warm my heart.
That's one way to get into it. And a lot of y'all sent a lot of great comments. One of them came from a Patreon. This was from Merle Nelson Lee. They said, "Sorry to hear about your knee. Glad you're keeping spirits up and persevering. I had a similar injury in 2021, and it's only been this year that I've been back 100%. It takes time to do your best, to be grateful for every milestone and improvement." And that was like what I needed to hear, you know what I'm saying? I really needed that comment.
More, please.
Another good comment. This one came actually from just the YouTube community because I posted like a little sort of blog post about it in my community tab on YouTube. And it was Queen of Sanity 3004 said, "Praying for your complete recovery, patience and waiting are not the same thing." And I was like, ooh, that's a testimony right there. That's what I learned when my broken ankle took forever to heal. So try to be patient, because either way, you'll have to wait on recovery. Stay blessed. And I'm learning as I'm going through this process. Yes, this was 100%. I ended up responding like, ooh, there's a bar with some crying emojis.
There are 3 functioning knees in this room.
Yeah.
And 2 people.
You do the math. An update from last episode where we talked about me getting my knee injury is that now it's official. I'm going to have to get surgery. So on this episode of the podcast, I thought it'd be fun. To break down how much I've spent so far in medical costs for my knee.
This is with insurance.
And this is with insurance.
It's actually not bad insurance. This is not CNN level insurance, apparently.
No. Folks at CNN have good insurance over there. We know, because we've got friends that work for CNN.
And they'll never leave.
Because
of the insurance.
Because of the insurance.
And the benefit. Well, the other benefits.
And the other benefits, yeah. The week before Halloween, I was playing soccer, and I got kicked in the leg while scrimmaging. And fast forward, I ended up getting an MRI and found out that I tore my ACL and will need surgery for that. And then I also tore my LCL, like a pretty epic tear. Not a full tear, it would seem, but like definitely grade 2 or 3.
3 is complete tear.
Oh, 3 is complete. Okay, so grade 2.
The grading system is dumb, but
yeah, grade
says a nurse. I don't know.
Grade 2 tear of my LCL, which is the outer part of the knee. So far, I have gone to the orthopedic peoples 3 times. Yeah, I'm about to actually go see the surgeon, so that'll be the 3rd time. Each time I've gone with insurance, it's a $60 copay.
Because it's a specialist.
Then I also got an x-ray, and that was the x-ray free?
No.
It was not. I got to go into the MyChart. I want to say the x-ray was $150. I should really keep track of all this. Side quest, remember?
It might be $120, sorry.
Remember I told you when we went to the Thanksgiving potluck thing, and so one of our friends, acquaintance, I guess, one of our acquaintances is an injury lawyer.
Oh, yeah.
And I told her about it, and she was like, "Ooh, do you want to sue the person that kicked you?" No. She was like, statute of limitations is 2 years, so keep all your medical bills just in case you change your mind.
I can't even understand how she would find that person.
Yeah.
A year or 2 years after the fact.
Right? I don't know.
You don't even know who that is now.
So we're at $180 in visits so far.
Okay.
Then I got an x-ray. That was $60. Then I got a MRI. That was $250 out of pocket.
Was it $250?
Out of pocket, yeah.
Are you sure?
Yeah, because they made me pay for it on the spot. Because remember when I went to go...
Because it should be $450.
Shh, be quiet. When I talked to the first PA specialist, he was like, usually your insurance won't let you get one. But because I've done this, he was like, I'm going to word it in such a way where they let you get it and they run it through the insurance so that way you can get it because I feel like you need one because I feel like you did mess it up enough.
The fact that the insurance would not approve that, given your medical history, the instability in the knee, and all the pain that you're in, like, is wild to me. It's going to drop an F-bomb. I hate insurance companies. Hate them.
So that was $250 because when I came in, you pay just like on the spot, the copay, and then you go get the MRI. So we're at $490 so far. This is with insurance. And then crutches. They gave me crutches, and I finally did see that showed up.
We paid out of pocket for that.
Was it out of pocket? Good. Okay. The crutches were $150 out of pocket, which, to be fair, I think you can technically go, like, you don't have to buy them through the office, you know?
It's just the most convenient thing.
Yeah.
Because then you have to go to a durable medical supply store.
Yeah.
You have crutches, yes, but we only have these sizes.
Yeah.
Oh, you don't have anything else? No. Okay, we'll go to another medical supply store. And they're not close. They're not clustered.
Yeah, they're usually quite far away.
Some of them are closed. Like,
very odd hours sometimes. I do remember that.
I don't understand how... Oh, this is a good segue to later on, but like medical supply companies don't even accept insurance, or not all insurances. So they're like, cool, you can have it, but you're going to have to pay out of pocket for it.
Oh.
You could buy some online and for like much cheaper. But again, the sizing is an issue. But short of that, I mean, like $30 on Amazon, if you can get it and wait for 2 days, is not bad.
Yeah. So then that puts us at $640 out of pocket so far. I'm just keeping the math tally.
Right.
Okay, so then now it's officially been confirmed that I am going to need surgery to repair my ACL. So I have to wait at least another 3 weeks before getting scheduled for surgery because I have to let my LCL like scar over first. So in the meantime, in between time, I'm doing what's called Prehab, where you're trying to get your leg strong enough to go into surgery with the best outcomes. Prehab happens once a week, and the copay for that is $20. I'm not scheduled for surgery until late January. So assuming that I at least do 4 sessions, which I probably will at least do that. I'd be very surprised if I don't. I would definitely, yes. I will do 4
Before
sessions.
surgery? Oh, yeah. That sounds doable.
Yeah, so I'm going to do 4 sessions, each are $20 copay. So let's go ahead and tally that in. And that's going to be, what's that math, 80? 720 is where we're at. Then now, final thing. Since they've already gone ahead and been like, yeah, we're going to go ahead and put your schedule your surgery in for late January. I got the bill for that already. And the bill was for a copay of...
Silent drum roll.
Silent drum roll. $250 so far. That's what I'll pay out of pocket. But that includes the hospital fees only. Apparently, the scheduler let me know there's 3 fees. There's the hospital fee, then there's the doctor's fee, and then there's like another fee.
It's probably like equipment.
Yeah, and I think you're right. Something like equipment or something like that.
God,
And so
someone correct me because I'm sure that's wrong.
Correct us in the comments if we're wrong. But so essentially, I have gotten the bill for just the hospital fee so far, and it's $250 out of pocket.
I think it's...
Is it the
it's for
hospital and the
everything.
doctor?
It's everything.
It's everything?
It's all in.
What do you think so?
It's on the quote.
It's on the quote.
It says it's on the quote. Also, are you getting this done at the hospital or is it at the outpatient?
It's supposed to be at the outpatient thing.
Okay.
They have a floor where you just go around the corner.
Just checking.
Oh, you were just curious?
Yeah, I mean, that's what you said before, and I just wanted to know if anything had changed.
Isn't this fun? Navigating healthcare is fun.
This is just
See how it says hospital fees?
Holy mother of God.
That's what I'm saying. So we're about to get to the T. All right, so
Beep, 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 beep. Beep.
hey everyone, thank you so much for listening / watching this episode of the Stumblewell podcast. If you're listening to us, if you're watching us here on YouTube, thank you so much for watching. Like, share, subscribe. It helps the episodes get seen by more people, which in turn helps the channel, which is dope. If you're listening to us wherever you get your podcast, thank you so much for listening. We appreciate it. Give us a 5 stars. Well, 5 stars is preferred, but we stand constructive criticism. You just need to be constructive with your feedback. And then if you want to take things a step further, consider joining the Patreon, patreon.com/Hallease. There you get early access to our videos, exclusive content, merch, and so much more. It's a good time. We actually have a new patron. Ressa. Ressa is a new patron at the courses level. Welcome, Ressa. Kitta just became a new free member. Welcome, Kitta. And then Brittany Williams also became a member at the fam level. Welcome, Brittany. But yeah, patreon.com/Hallease. There you get early access to these videos, exclusive content, merch, and more. Now, but if you're sitting here and you're saying, oh my gosh, Hallease, I can't have another subscription. I just can't do it. I won't do it. That's fine. Buy us coffee. Coffee.com/Hallease. Because we drink it. This one's decaf because I already had one today.
This one's empty.
Oh, you drank all your tea already?
It's gone.
Yeah. Mr. Hallease drinks tea. I drink coffee. But buy us a coffee. Come to Greece.
Go out and do amazing things because someone's got to.
Yeah, go be great. Well, here's what it is. The estimate reflects charges for hospital services only and does not include physician fees such as anesthesiologist, radiologist, or surgeon. Physicians will be billed separately, so I haven't gotten the bill for my actual surgeon. I've just gotten the hospital bill. Okay, so here's the T. All right, so I'm going to pay $250. That's what it's saying my hospital fee copay will be. But they show you how much the total fee is in the bill. Y'all, drum roll. $62,611 was the total. That's insane. I just pause for effect, y'all. That's insane. And then it shows in there, like, insurance is going to cover $62,361. So that way you will pay the $250. What's crazy though is if you try to go to like, I want to view the details, there's no details. It doesn't tell you like what's included in the hospital fee. I'm also incredibly grateful that I am on your insurance.
Yeah, I mean, the marketplace plan that we had was not great. But that's because nobody's willing to get on the carousel and push. No one's willing to get off the carousel and push. Everyone just wants to ride the carousel.
Yeah.
And so then the carousel isn't moving. And then some people are like, well, you know what? We don't even need this carousel. We're like, no, wait, some people want to be on the carousel and need the carousel in order to stay alive. And then those people are like, no, we get rid of the carousel. And then there's a back and forth about the carousel. And all along, all the while, the children weep. The children weep because all they want is just be on the carousel. It should be a basic human right to be on the carousel and just have all the benefits that come from the carousel, like long life, manage comorbidities, not having to get amputations.
I think the thing that kind of blew my mind seeing the bill was the negotiation of it. So when I clicked in further, I just pulled it up because I was able to. When I clicked in further to like see the estimate, it shows like the estimated total charges, right? $62,611.48. But then it shows the estimated negotiated amount, parentheses allowed, is $13,594. So it's like literally the insurance is like, no, this procedure really costs $13,000, which I personally believe is a lot better than $62,000.
So
I am just like, how can you negotiate that epically?
this is from the American Medical Association Journal of Ethics.
Okay.
So most hospitals have a charge master, I'm using air quotes for those of you listening, which is an itemized list of prices similar to a restaurant menu.
Okay.
Healthcare facilities often set chargemaster prices at many times the amount for which they are reimbursed or paid by insurers. While this may sound strange at first, it allows hospitals to set a high starting point for the ensuing closed-door bargaining with different commercial insurers, and very high charges for the small fraction of self-pay patients who can and will pay the chargemaster or sticker price. And actually, so that's the thing. It's sort of like not putting something on your credit card and paying cash, like you're going to have a discount. So in order to not have the back and forth with an insurance company, you actually frequently, depending on how good or crappy your insurance is, you may have a better deal paying something out of pocket. Because they're like, yeah, we don't have to bicker with anybody. Flat fee. This makes life fairly challenging for anyone trying to answer the question, Doc, hand on hip, how much is this going to cost me?
Yeah.
Even if the doctor knew the charge, which they don't, and they don't understand billing. Well, they do understand billing, but they don't have any control over billing for the most part. Like, they don't know what patients are paying when they come in, which is also good and a benefit to the patient. So there's no, like, bias in that sense.
Sure. That makes sense.
But even if the doctor did know the charge, he or she, they, them, would be unlikely to know the specifics of a particular patient's insurance plan. Of course they wouldn't, because it takes an hour-long conversation to speak with somebody across the globe who does not have a sense of what they're talking about regarding an insurance company. I'm looking at you, Blue Cross and Blue Shield. You are garbage customer service. Garbage.
You want to get some things off your chest?
That was it. Anybody who subscribes to Blue Cross knows. They know. You get somebody on the phone, and it ain't a good experience.
Yeah.
It's almost like they don't want you to get anywhere. Anyway, back when I was doing cardiac quality, that it was a relatively new cardiac procedure. Just overhearing the surgeon say, "Yeah, we're just gonna charge whatever I want. I think I'm just gonna charge like $150,000 for that. Just doing it, like the physician charge." And again, it's because so that there was no benchmark.
Yeah, because it was such a new procedure.
Medicare had not, I mean, Medicare may or may not have like set something at that point. It was like, yeah, so I'm going to do this, and I'm going to charge this, and then we'll see what the insurance companies pay. And then oftentimes now, and I really need to look up the term, but so this will be a thing where the doctor's office says, well, it's going to cost this. And then the insurance company says, well, no, it's going to cost this, or this is how much we're going to pay you.
Yeah.
And so then what doctors are doing now is that difference between what they're paid by the insurance company and what they quoted, they're billing the patient.
That would mean...
That's not what's happening here because...
No, yeah. But if that were to be the thing, because it's 62,611 minus, they said, nah.
250.
No.
13.
They said, nah, this procedure costs 13,543. Let's say that. So I would be billed $49,000 if that were to happen.
Right.
That's insane. But then it's like, can you put a price on your health though?
Yeah, sure can. People do it every day. People do it every single day.
Obviously, for one, I'm incredibly grateful that we have insurance and that I'm on your insurance and all the things. Because it's like, so how many people are out here in the world with torn ACLs that are just like, oh, well, you know?
Well, also imagine the people that can't afford the diagnostics.
Yeah.
And so they just ice their knee and don't.
Yeah, just kind of just wear a brace and just.
Yeah, and you just manage, and it's just all bandages.
Yeah.
And then maybe eventually they go see a doctor, and the doctor's like, yeah, it's going to be surgery, or you could just not do anything.
Yeah.
And hope for the best, and then they don't do anything, and they do hope for the best.
Yeah. Because I remember the first time I went into the orthopedic office and I saw the sports PA first, he was the one that was like, based on what you've told me, I'm going to put things in your chart so that way you can go get an MRI. Because he was like, sometimes based on what it is, they won't even let you get it to even confirm what's going on. Instead, they're just like, well, you might have torn it, so let's just put you on some physical therapy for like 2 or 3 months and see what happens.
And again, the reason behind that is theoretically in the interest of the patient. So you don't have physicians charging the interpretation for MRI results or something, right?
Sure.
And just ordering willy-nilly stuff that the patient doesn't need. And so it's like, well, okay, yeah, the insurance companies are saying, no, this needs prior authorization or this needs to hit certain criteria, otherwise we're not going to pay for it. But then they become so protective and all the guidelines become so restrictive that patients can't get the thing that they need. Like if you could not have gotten an MRI, then it's like, okay, so what do we need to prove? Well, she needs to get an x-ray first. We already got the x-ray. Well, how bad does it look? What do you mean how bad does it look?
Yeah.
But yeah, then you have like that extra gatekeeping.
Yeah.
And so then you have to choose very carefully the words that you say to make the case that the patient needs this thing. And then you send it, you fold it, and you turn it into an origami crane, and you send it off into the wind.
Yeah.
And you watch as it like catches its little paper wings and it floats off, and you're like, wow, I really hope that's not going to come back to me in 2 weeks with a really angry letter saying, no, denied.
Yeah.
They're just going to decapitate the crane and send it back with a rock or something.
Yeah. I don't know, man.
But I mean, medicine is a business in the westernized civilization / I mean, especially in the U.S., it's a business first and foremost.
Yeah.
Like, you have people, seldom, you don't have doctors anymore who are CEOs of hospitals. There's one at my current healthcare facility, which is a rarity. It's usually just business folks. It's just business folks that went to business school and, you know what, I'm just going to go lead a hospital. They go do that. It's like, well, you need to make us money. No problem. I'm good at making money.
Yeah.
And then they just take the helm, and it's like having a scarecrow drive a boat. I'm like, what? Yeah, I mean, it's more or less doing the thing. It's like, we're headed to shore. Yeah, but we're making really good time getting to those rocks. I mean, you're going to be shocked by how fast we get there. But yeah, I mean, it's all about money, and it's not really about serving patients. And man, I mean, how long do you want to talk about this? We can just go until the battery dies.
Well, sure, yeah. I mean, I knew all of that going into it, but it's been another side of it to kind of just experience the things, and even
to
just
be the one that's
and be the one that's like having to navigate it in this way. Because even just with so talking to the second PA of like, you'll probably need to get surgery if you want to be back up and running. Hearing him talk about like, because it's so close to the end of the year, right? So everyone's trying to clamor to get with the surgeon, so that way they can hit deductibles and things like that, and so less out of pocket potentially. And so we were in the room, and he was like, and like the way he became so dejected about like, so yeah, are you trying to get this done before the end of the year? Or and I was like, I mean, that would be cool, but is there availability? And he was like, I don't know, because we're doing surgeries Christmas Eve, and then we're doing surgeries the day after Christmas, so we'll be around. And I was just like, do I even want a surgeon trying to do stuff on me the day after Christmas? You know what I'm saying? Like, just like the amount of stress. I don't know. It's just fascinating. I was just like, bro, put me in when it makes sense. Okay. You know what I'm saying? Thankfully. And then that's another like privilege of realizing like, the deductible thing isn't like too much of an issue for me.
With our current plan.
With our current plan.
I mean, it's like.
So it's like, just fit me in.
It's really,
I mean, I would like to, yeah, it's like I would like to have this done before Q1 is over of next year, but please. Because there is apparently somewhat of a limit of like, if you tear your ACL, you kind of do need to get, if you're going to do surgery, you need to do it like pretty soon after the injury. And I'm kind of pushing it by end of January, but no, I mean, yes and no.
We're moving as fast as the healthcare system has allowed.
Right, and that's the other thing that's been interesting too, because it's like seeing my brother-in-law's experience with it. Like he tore his, and he said within 3 days he got the surgery. Because it was just like, oh.
But he was probably established with that doctor already. He might have been, or was he not?
No, he had 2 different doctors that did his.
San
Antonio's just built different, you know what I'm saying? Medically. I'm learning that medically, San Antonio is, or even just Texas in general, is just built a little differently. I think what's also really interesting about tearing your ACL is like you don't really need to be an incredibly active person to tear it.
Oh, yeah.
Case in point, my sister, like, tore both.
I thought she tore one playing sports.
No.
Oh, okay.
She was teaching, and she...
Oh, that's unfortunate.
It was field day with the kids.
Well,
and she didn't even do anything crazy. She just jumped and...
Oh, it was just a jump.
It was just jumped and just landed kind of weird, and she heard a pop. And that was that.
Dang.
And then the second one...
That sucks.
Yeah.
That
and
sucks.
then the second one, she said she was twerking in the kitchen. So, and you're so red right now.
Oh, no.
Yeah.
No. Oh, that got me.
I'll confirm with her, but I remember her saying that. She was like, girl, I was twerking in the kitchen toward the other one. I was like, what? Right, hey, y'all. So, editor Hallease here. I wanted to make sure I give y'all the correct facts on my sister. So she tore her ACL, MCL, and LCL while playing volleyball with the kids during field day. She went up to spike the ball and then landed. And then the second knee situation was that she didn't actually tear her ACL. She tore her meniscus, and she did indeed tear it twerking. Let me make sure I'm saying accurately. She made sure to tell me, to make sure to tell y'all that she was indeed twerking. She was doing the best dances, and even though in the moment she snapped her meniscus and felt it, she still managed to hold onto her beverage. And she also said to make sure to let y'all know that when she explained to the nurse what happened, that the nurse was impressed by that she was able to tear her meniscus while twerking and yet still hang on to her drink. All right, back to the podcast. Yeah, I remember she tore the first one right when she started dating my brother-in-law. I remember that. Like, they had just started dating, and then she tore it. And then she was like, well, not going to show up on that date, because yeah.
Well,
So I feel like, especially, apparently, the research does show this for women, ACL tears are, like, really common. So apparently it's something about, like, the ratio of, like, hips to something, like, center of gravity type things. Like, we're just more prone to tear it than men generally. And so I was like, oh, that's a bummer. It's been interesting to compare, how long the process of things and how long things take in a bigger, more populated city, even though you have more access to higher quality care. I assume, yes.
We're assuming. I
think so. I
don't think so.
You don't think so?
Mm-mm.
Here in Atlanta?
San Antonio had a great medical system.
Well, I meant more in terms of like, San Antonio does have a really great medical system. There's a lot of research that happens there. But I meant more like in general, like say if we lived out in, like way out in the, I don't even know. I'm trying to think of like one of the Mableton, like just out a ways.
One of the tons.
One of the villes of Georgia and having to commute in. Like I think about that with your parents as well. Like living in Laredo and always commuting into San Antonio to see whatever specialist.
Although their ortho, again, stays booked.
In Laredo.
Yeah. He's booked.
Yeah.
Solid.
Oh, I'm sure. Because he's the only player in town. Big fish, small pond.
Well, exactly. So, I mean, he's still getting all the reimbursements. He's still getting, like, all the clientele.
Yeah.
He chooses when he practices.
Yeah.
But, yeah, and he has good results. I mean, my mom didn't get an infection, which is
Yeah.
great.
Oh, yeah. She had her knee replaced, right?
Mm-hmm.
Yeah.
Total knee.
Total knee replacement. And she's doing great. She's doing really well. But it's just, yeah, going through this process of seeing, thankfully, 24 hours after the initial injury, getting in with the sports PA to just like get the ball rolling was good, because then it took forever. Well, not forever, but it took like from that time that happened to finally getting to see the surgeon, which is not happening until Monday officially. It
Sorry,
took
I
a
thought it was
month.
December.
Like, because he was just that booked and that busy.
So as much as I was upset with the timing of things, it's still not out of the realm of like realistic expectations.
Right, yeah.
To go from the discovery and the confirmation of the injury to seeing the specialist in a month, that's not bad.
Right.
Because at Emory, remember I had like, oh, my anxiety thing and like, oh, I'm having weird symptoms.
Mm-hmm.
Like, well, you go see a cardiologist. Okay, well, you see a cardiologist in like 3 months. Like, okay. Well, I hope this isn't serious because
Yeah.
I don't know.
And like that was the only time they had available, and that was the soonest. Yeah.
But yeah, we got really lucky being able to see the sports medicine doc.
Praise be to God. It's been interesting because there was a study. I want to make sure I like quote it correctly, but there was a study that looked at 10 countries, the U.S. being one of them, and it's all like Western countries. So it's like Australia, Switzerland, New Zealand, Canada, France, Germany, us, the UK, and I think like one other. I'm missing one other one. But it was a study done to show like the differences in healthcare and like the experiences of healthcare, and it ranked us all. Bro, we were number 10. Like, and everything on the thing was like down into the, like, you know, they put a graph of like most expensive versus like quality versus blah, blah, blah. And like everything, like a lot of them for us was just like down and to the right, down to the right. So it's like the worst you could get. And I was like, oh no.
But so
we got to do better.
the summary, more or less, was Americans are sicker, die younger, and struggle to afford essential health care compared to the other 9 high-income nations.
Yeah.
Ranking last overall with a lower life expectancy and higher rates of death and disease, despite spending the most on health care.
Yeah, and that was the other thing where there's just like comparing the costs versus the quality. So we actually did, apparently, when I was looking at it, we did rank actually decently on quality.
Oh, good.
Yeah. But in comparison
Means
to,
nothing.
yeah, I know you're jaded about it. But in comparison to like the price, it was, yeah.
So we rank decently, not top, but we rank decently in terms of quality.
Just this sentence alone. In the U.S., lack of affordability is a pervasive problem. Just that sentence to start a paragraph is just like,
Now imagine you're a dialysis patient, right? And you have Medicare. So you have insurance, right? Which is fine and good. So aside from all the lack of things, go ahead.
No, I'm sorry. Sorry, I wanted to correct it. It was that we ranked among the top. We were among the top performers for care delivery process.
What does that even mean?
So here, I'll just read it so you can see. Care process looks at whether the care that is delivered includes features and attributes that most experts around the world consider to be essential to high quality care. The elements of this domain are prevention, safety, coordination, patient engagement, and sensitivity to patient preferences. Most notably, the U.S. is among the top performers on care process, ranked second. New Zealand was first, and Canada and the Netherlands close behind. Sweden performs comparatively poorly. Strong U.S. performance in the care process domain is the result of the successful provision of preventative services, such as mammograms, flu vaccines, and an emphasis on patient safety.
I'm sure those are just examples, which, yes, I mean, with immunizations, good.
Yeah.
There has been a push on that.
Yeah, we do a lot of researchy things.
But like lowering cholesterol, which is pretty basic, improving glucose levels, especially amongst minorities.
Yeah.
Nobody doing that. Ain't nobody doing that. Is it consistent where someone hits pre-diabetes, where the A1C reaches, a certain threshold?
Yeah.
That it's mandated that they see a dietitian? Or we don't shoehorn them into a diet program. We actually see what they're eating, and then we do culturally competent guidance on how they can improve themselves. Because what's killing people is not the flu. The flu is killing people, yes, but like consistently every year, year over year, over the past century.
Yeah, it's
been
high blood pressure, diabetes. It's heart stuff and glucose stuff.
High blood pressure, which is a silent killer because it typically doesn't have symptoms. Diabetes, which it destroys capillaries, it destroys vessels, it destroys arteries, destroys your kidneys. It increases the risk for cardiac disease. And then there's cardiac disease itself because we eat so much meat and saturated fat, which again can impact your kidneys, can lead to stroke, can kill you because of a heart attack, or can cripple you because you have occlusive disease in your arteries throughout your body. And where is the prevention in that? They typically.
I don't know, I'm just telling you what
No,
the study
I'm sorry.
said.
This isn't aimed at you, but it's like,
Yeah.
so are we top?
Yeah.
Are we top? And then the other focus was like patient safety. It's like, what does that mean?
For those of y'all, for context, y'all, Mr. Hallease used to work in quality. So literally, he used to be in the hospital and would see the patient outcomes from surgeries. And if there were complications or that patient had like things go wrong, he was in charge for like researching or like figuring out what happened and why things didn't go right. So he's very
Right, and then like you
in
go to
the data.
You go to all these hospital systems and they're like, oh yeah, we're all about patient safety. And it's like, okay, so like there's no serial killers roaming the hallways with a knife? Great, love it. I mean, thank God. Could not sleep at night without that. But like, what does that mean?
Yeah.
Like when a doctor has hit a certain number of preventable deaths, that he's not allowed to practice until there's a committee meeting or something, and then that don't happen consistently. Is it, I don't know, like a lack of serious event that is being measured, which I think is more or less the thing, but like just because it's the focus
Yeah.
doesn't mean that the outcomes are also coming. You know what I mean?
Sure.
Sorry, I'm just like poking holes in that.
Yeah.
Like, oh, we ranked 2. Yay! On what? 2 based on what? We're still dying more than any other country, or like and younger,
Western developed country.
or just like high income.
High
countries.
high GDP country, I guess. Sure. All that to say, that's the update. I'm just 62K. I was shook when that came through. I'm finna pay it. Look, I was like, well, I'm gonna pay this $250 and praise God from whom all blessings flow.
And you saved
Jesus.
that letter because it's like, you said it was this.
You said $250. I'm paying you $250 and not a dollar more. Oh my gosh. And that's only the hospital bill. That's not what the physician bill will probably be, or the equipment bill.
Yeah, but it's not going to be as high as that.
250? Or you mean the 62K?
62K. You know what? I don't know because I'm not a doctor.
Yeah.
So it might could be.
In the comments below, if y'all are curious to hear what it ends up being, maybe we'll do a follow-up episode. After I have surgery, we can like fully break it down. All right, guys, here's out of pocket. Here's everything I paid. But here's what they quoted.
Tell us your surgical success stories. Let's all
Yeah. In the comments below, tell us a good surgical...
combat Chris's negativity. Sorry.
Yeah. In the comments below, tell us a good surgical outcome you've had, where everything kind of worked out and you're doing better.
Yeah.
Because, yeah, I'm probably going to have surgery, so I want to hear good stories. Happy stories. Stumble well.
And this is a warning to all of you. Don't twerk in the kitchen. Stumble on.
And we'll see you in the next podcast episode.